Today, we'll explore osteoid osteoma, a benign but highly symptomatic bone tumor, most often affecting young individuals. One of its hallmark clinical features is pain, typically severe and progressive. This pain is not only localized, but often associated with vasomotor disturbances, including profuse sweating and increased skin temperature over the affected region. Clinical mimics. Clinically, osteoid osteoma can mimic degenerative arthritis, inflammatory arthritis, and even septic arthritis, making early diagnosis challenging. A classic description is the gradual onset of deep, aching pain, which becomes increasingly severe over time. Notably, around 65% of patients experience dramatic relief with aspirin, a diagnostic clue that should never be overlooked. In about 30% of cases, the pain may radiate to a nearby joint, potentially misguiding the radiological examination and delaying accurate localization. Spinal manifestations. Spinal osteoid osteomas have unique presentations depending on the vertebral level involved. Lumbar and thoracic spine lesions typically present as painful, rigid scoliosis, especially when the lesion lies on the concave side of the curve. Cervical spine involvement can manifest as torticollis, secondary to contracture of the sternocleidomastoid muscle. Lesions affecting the spinous processes of vertebrae do not produce scoliosis or torticollis, but may still cause localized pain and spinal stiffness. Take-home message. Recognizing the pain characteristics, aspirin response, and site-specific clinical manifestations of osteoid osteoma is key to early diagnosis and appropriate imaging. Stay tuned for Part 2, where we'll dive into the radiological features and imaging approach for diagnosing osteoid osteoma.